Hi. We hear some news about the black fungus, white fungus, and recently even the yellow fungus. So, do you know what is this all about? Straight Times in an article yesterday quoted, "The public must know more about black fungus." These black fungus, white fungus, and yellow fungus are all related to COVID infection. This video has the recent details about the black, white, and yellow fungus, their symptoms, and the treatments. After a significant number of COVID-19 cases, the black fungus was first traced on 9th January 2021. 8 cases were traced by then around the world, and it is said that this fungal infection is triggered by coronavirus. The most common risk factor to be affected by black fungus was found to be diabetes. Early aggressive treatment is considered essential. If not, this black fungus, also called as COVID-19 associated mucormycosis, can be fatal. Currently, around 8,000 people are affected by black fungus and around 300 people have died. And the government of certain states in India like Rajasthan, Haryana, Tamil Nadu, Telangana, Gujarat and Bihar has declared this black fungus as an epidemic since this May 2021. Mucormycosis affects the sinus and lungs of a patient and manifests itself with swelling on one side of the face, severe headache, nasal congestion, black lesions on the nose or upper side of the mouth, coughing of blood, chest pain, breathlessness, and also affects the vision. It can further cause difficulty in chewing or even opening the mouth and loosening of teeth. It then spreads to lungs and can even spread to the brain. The most important thing to note is this condition does not spread person to person. COVID-19 associated mucormycosis has mostly affected people in India, and this could be because of the remarkable high rates of COVID infection and high rates of diabetes in India. Senior doctors of Delhi has said that black fungus can be treated if diagnosed early and that it is a rare infection found mostly in the COVID-19 patients. Though this black fungus can spread through air, it will not cause any problem if a person is healthy. After the black fungus infection being called an epidemic, most experts have cited alarms over the discovery of white fungal infection. This is called aspergillosis, and this white fungus is reported to have been detected in COVID patients from several states across India. Some health experts believe that this white fungus is more dangerous than the black fungus as it can affect several parts of the body like the nail beds, skin, stomach, kidney, brain, and even the private parts. White fungus infection is more common in people with low immunity and pre-existing medical issues like diabetes, cancer, and so on. It may also be detected in patients who have been on steroids for longer period and those who have been in ICU for an extended period. The most common symptoms of white fungus infection are cough, fever, diarrhea, dark spots, and reduced oxygen level. The symptoms are almost the same for black and white fungus. However, the doctors have reportedly said that the yellow fungus starts infecting the patient internally. Infection actually begins from the tongue or private parts, due to which it turns white and hence the name white fungus. Just like the black fungus, the white fungus also does not spread from one person to another. It is said that this rare fungal disease symptoms are very similar to the SARS-CoV-2 infection. This attacks the lungs and can be detected by performing a CT scan test. Hence, the patients are advised to seek the medical treatment at the earliest once they experience the related symptoms. It is said that it can be treated if diagnosed at the initial stage. After the country has seen a significant rise in the number of black and white fungi cases, a patient was recently diagnosed with yellow fungus in the nation's capital region. The first case of yellow fungus was reported in Ghaziabad. The patient diagnosed with yellow fungus is currently undergoing treatment at the hospital. Yellow fungus is more damaging than the other two fungal infections because it affects the body's internal organs. It starts off internally, causes pus leakage, slow healing of wounds, and in severe cases, it can even lead to organ failure and acute necrosis. Some doctors have warned that yellow fungus can pose more risk than the black and white fungal infections. At the onset of the infection, patients may experience lethargy as it spreads internally, affecting organs and draining people of energy. Patients may even lose appetite or develop poor eating habits, which may eventually result in unusual weight loss coupled with poor metabolism. In some cases, yellow fungus may affect the eyes of the patient, and in such case, one must watch out for redness and sunken eyes. Like most fungal infections, this is also primarily caused by unsanitary conditions such as poor hygiene, contaminated food, and oxygen source. Overuse of steroids and antibacterial medications can also cause such infections. Patients who have more than one disease or those who are on immunosuppressants may be at greater risk of contracting this infection. The cure for this is not very certain, but the health experts state that healing yellow fungus takes much longer compared to the black or white fungus infection. Doctors suggest two main advices to avoid such fungus infections. The first one is one must first avoid getting COVID-19 infection, and therefore it is important to strengthen the immunity. And secondly, if infected by COVID, do not overuse steroids during the treatment. Steroids should be given only when the oxygen level goes down and the pneumonia occurs. When the condition is stable, reduce the number of steroids so that there is no problem of blood sugar fluctuation. White, black, and yellow fungus infections can be avoided by following these two methods. India is reporting a fewer number of cases recently, with the experts saying that the deadly second wave of the coronavirus will recede sometime in late June or early July. States across India are, however, playing safe and have extended the lockdowns in their places. These curbs have helped in reducing the daily caseload hugely, but it is the truly little stock of vaccine that is causing huge tensions to both state and health officials. In fact, the vaccination centers in cities like Delhi and Mumbai have totally stopped working due to lack of stocks. People are struggling with the CoWIN portal every day to try their luck in getting the vaccination slot. Amidst such a situation, there has been a recent speculation about the third wave being even stronger than the second wave. However, a third wave is not something that can be predicted right now. So stay safe, practice proper hygiene, and at this crucial time, try to help one another with what you can. See you in the next video. Bye-bye.